Schizophrenia. Introduction to the module. In this module, you learn about schizophrenia and the impacts it can have on people who suffer from it. We will look at the different types of schizophrenia. We will discuss what they are, what might cause them, and how they can be dealt with effectively. We will also briefly cover psychosis, which is not a schizophrenic disorder, but can be caused by schizophrenia. Please remember that medication can only be prescribed by GPs, psychiatrists, or nurse prescribers. Topics to be covered in this module. What is schizophrenia disorder? Hallucinations. Delusion. Paranoid schizophrenia disorder. Disorganized schizophrenia disorder. Catatonic schizophrenia disorder. Psychosis. What is schizophrenia disorder? Schizophrenia disorder results in the patient being unable to interpret reality correctly. This is sometimes referred to as psychosis. Schizophrenia disorder leads to the patient acting in ways which seem inappropriate based on reality. However, to the patient, their behavior is logical and reasonable. This is because they are misinterpreting reality. A person with schizophrenia disorder may respond negatively to everyday events like the arrival of the postman. They may also be unable to tell the difference between fantasy and reality. Hallucinations. A person with schizophrenia may experience hallucinations. Hallucinations are experiences which seem real, but which are not based on reality. Hallucinations are commonly associated with visual experiences, but they can engage any of the five senses. Patients experiencing hallucinations might see, hear, feel, smell, or even taste something that does not exist. These hallucinations seem as vivid and real as any actual experience to the person hallucinating. Delusions. Delusions can be caused by many mental illnesses, including schizophrenia disorder. The term delusion refers to a false idea which the patient is absolutely convinced is true. The patient will not believe any evidence to the contrary, no matter how convincing. This belief is usually unrelated to religious or cultural beliefs. Delusions can be difficult to distinguish from firmly held beliefs. The distinction lies in the degree to which the patient is convinced that their delusion is true. Paranoid schizophrenia disorder. The term paranoid schizophrenia disorder refers to patients who suffer from delusions of grandeur, or believe they are being persecuted without any basis in reality. Patients may believe anything about themselves, including that they are royalty, or that the entire world is against them. Paranoid schizophrenia disorder can lead to auditory hallucinations, hearing voices that are not there. High stress can worsen the disorder and its symptoms. Causes. There are no known specific causes for this disorder. It is believed that there may be some genetic predisposition. Patients diagnosed with paranoid schizophrenia disorder are more likely to have a close relative who has also been diagnosed with it. The fact that stress can contribute to it may indicate that the patient's environment can also play a role in causing it. Symptoms. Paranoid schizophrenia disorder is characterized by several different symptoms. A patient does not need to display all of them to be diagnosed with the disorder. Symptoms include delusions of grandeur, delusions of persecution, quick to anger, highly argumentative, violent and easy to provoke, very formal even in close relationships. Treatments. Most patients with paranoid schizophrenia disorder respond well to the treatments which are currently available. These treatments typically include psychotherapy. This involves providing the patient with an environment in which they feel safe talking about their internal conflicts. The therapist can help them resolve these conflicts by exploring and discussing them. Medication. including thorazine, Risperdal, Seroquel, Haldol, Zyprexa, and Abilify. Disorganized schizophrenia disorder. Disorganized schizophrenia disorder refers to patients who have a decreased ability to perform daily activities. Patients may respond to situations in ways which seem illogical to others and might not be able to complete basic tasks. Patients who have disorganized schizophrenia disorder may also struggle to speak sensibly. It can be difficult for them to communicate well with others. This can lead to problems interacting with others. Causes. As with the other types of schizophrenic disorder, there are no known causes. There are some theories that it may have genetic links, as diagnoses can run in families. Symptoms often appear gradually and worsen over time. Symptoms. There are various signs and symptoms which can help diagnose disorganized schizophrenia disorder. Like other kinds of schizophrenia, they vary between patients and may not all be present. The symptoms include incoherent or disorganized speech, social withdrawal, difficulty expressing emotions, also known as blunted affect, disorganization affecting the ability to carry out daily tasks, hallucinations, delusions. Treatments. Again, treatments often include a combination of psychotherapy and medication. The medication may help to mitigate some of the symptoms of disorganized schizophrenia disorder. Treatment is crucial to avoid major issues such as homelessness and drug abuse. Psychotherapy usually includes providing an environment in which patients feel safe. Patients can then discuss internal conflicts with their therapists and search for resolutions to them. Therapists may be able to assist. Medication can include Haldol, Risperdal, Seroquel, Abilify, and Zyprexa. Catatonic schizophrenia disorder. A patient with catatonic schizophrenia disorder will experience periods in which they are dazed and unable to function. This often involves not being able to move or speak. They will also experience periods in which they are hyperactive. These can result in bizarre actions and excessive talking. Patients who suffer from catatonic schizophrenia disorder can be destructive. It is not a common disorder, though the symptoms of it can sometimes be caused as side effects of medications or medical disorders. Causes. There are no known causes for catatonic schizophrenia disorder. Genetic links can again be found in these cases too. It is more likely to run in families. It is possible that the environment and chemical imbalances in the brain may contribute to it, as they can to other forms of schizophrenia, but this is not known for sure. Symptoms. There are some very specific symptoms which indicate the existence of catatonic schizophrenia disorder. Although there is no specific test for it, two or more of the following symptoms may indicate that a patient suffers from it. Periods of stupor, close to unconsciousness, muteness, bizarre mannerisms, movement without purpose, mimicking speech, rigidity or resistance to movement, physical inability, imitating movements of others. Treatments. Treatments are generally aimed at lengthening the period of remission for the patient. They are often successful in doing so. Medication is often the first step in treating this disorder. Catatonic schizophrenia disorder can be treated in the following ways. Medication. Valium and Ativan are commonly used. Electroconvulsive therapy, ECT. This involves passing small electric currents through the brain while the patient is under anesthetic. Ensuring good circulation by providing some passive motion treatments. Psychosis. Psychosis refers to a condition where the patient has lost contact with reality. It is usually the result of some mental disorder. It can involve hallucinations or delusions, or both. Individually or combined, these can lead to extreme stress for the patient. They may result in altered behavior. Psychosis is often episodic, and episodes can vary enormously in length and severity. Causes: mental disorders, like schizophrenia, can result in psychosis. Psychosis is also commonly associated with bipolar disorder, a mental health disorder which affects mood, and severe depression. Many of the symptoms overlap. There are other potential causes too. These include high levels of stress, side effects of medication, drug or alcohol abuse, traumatic experience, physical conditions, for example brain tumors. People experiencing severe psychosis often need to be hospitalized. Symptoms: there are two main symptoms of psychosis, which are hallucinations. The patient's senses report something which is not real, although it feels very real to the patient. Delusions. The patient strongly believes something which most other people know is wrong. They cannot be persuaded that the belief is incorrect, even when shown concrete evidence. Treatments. Fortunately, there are multiple treatment options that can help to deal with psychosis. They are often used in combination to produce the best results. They include social support. This involves helping a patient with their needs, such as housing, education, and employment. Providing these things can help give patients stability. Therapy. Cognitive behavioral therapy, one-on-one discussions with a therapist, have been shown to improve psychosis. This is often used alongside discussions with and support from family and friends. Antipsychotic medication. This can help to deal with the symptoms of psychosis and enable a patient to connect with reality. Summary. In this part of the course, you have learned: schizophrenia makes it difficult for patients to interact with reality and can result in patients being incapable of managing their lives or knowing who they are. It often causes delusions and hallucinations, and treatments involve therapy and medication. Schizophrenia has few known causes, though there are genetic links. Various types of schizophrenia disorder exist, including general schizophrenia, paranoid schizophrenia, disorganized schizophrenia, and catatonic schizophrenia. Psychosis is the name commonly given to episodes involving delusions or hallucinations, or both, with various treatments being available.